Dr. G. Durga Devi, Professor and Head of Anatomy. I've served as a medical educationist for more than 10 years with anatomy teaching experience for more than 15 years. I've been mentoring both undergraduate and postgraduate students. I have great passion for teaching and I take immense pride in claiming that I can make complex anatomical topics into simpler ones. And I've also been a life member of notable professional bodies in India. Now, today's topic is osteology of the skull, and the objectives for today's session is, by the end of the session, the student should be able to describe the various bones of the skull and study the skull under the various views, which include the norma verticalis, norma frontalis, norma occipitalis, norma lateralis, and norma basalis. Just an overview and the divisions, or giving a brief introduction. The skull forms the bony framework of the head and consists of 22 bones. It is divided into the cranium or the neurocranium and the facial skeleton. Now, the cranium and the calvaria, the cranium enclosing the brain, and it is further divided into the calvaria or the cranial vault, the dome, the upper dome part, and the cranial base, which forms the floor. Now, this can be studied under the various views for descriptive purpose. It is essential to study the skull under the following headings, that is norma frontalis, lateralis, occipitalis, and the basalis. Now, coming to the anatomical position of the skull can be kept in the anatomical position based on two lines. One is the Reed's baseline, which is nothing but a horizontal line which is drawn from the infraorbital margin to the middle of the external acoustic meatus. The next is the Frankfurt's horizontal plane, which is drawn from a horizontal line which is drawn from the infraorbital margin to the upper margin of the external acoustic meatus. Now let us move on to the exterior of the skull. Now the various views to start with is the norma verticalis. What is norma verticalis? It is the observation of the skull from the superior aspect. This is called as the norma verticalis. Now, the shape of this view is ovoid in shape and relatively wider posteriorly. What are the bones that form the norma verticalis? The frontal bone, which is found anteriorly, the occipital bone, which is found posteriorly, and the two parietal bones which lie on the either side of the midline. The junctions of the bones, which are called as the sutures, which are fibrous in nature. The sutures are immovable joints, and the sutures that are observed in norma verticalis are coronal suture, that is between the frontal and the parietal bone, the sagittal suture, which is between the two parietal bones, and the lambdoid suture, which is between the occipital and the two parietal bones. Now, some notable features of the norma verticalis include, and certain important terms of the norma verticalis are the vertex. The vertex is the highest point on the sagittal suture. What is the vault? Vault is the arched roof of the skull. Bregma, it is situated at the intersection between the coronal and the sagittal suture. Now, this is a membranous gap, especially in the fetal skull, and in the fetal skull, it is known as the anterior fontanelle, and it fuses or closes by 18 months. Lambda, it is situated at the intersection of the sagittal and the lambdoid suture, and in the fetal skull, it is again a membranous gap, and it is called as the posterior fontanelle. The posterior fontanelle closes by 2 to 3 months after birth. Next is the parietal foramen. So the parietal foramen is present 3.5 centimeters in front of the lambda, and it allows certain emissary veins. It is a region on the sagittal suture between the two parietal foramina. What is the parietal eminence? It is the area of the convexity of the parietal bone. The temporal lines. There are two temporal lines, superior temporal line and the inferior temporal line. Both the temporal lines start as a single line from the zygomatic process of the frontal bone. The applied aspects of norma verticalis include the fontanelles, which serve for two important purposes. They allow molding during birth, and also they allow the brain to grow. So the anterior fontanelle is both clinically and therapeutically very significant. A bulge in the anterior fontanelle includes increased intracranial tension, and abnormal depression indicates excessive fluid loss, especially during dehydration. And for diagnostic and therapeutic punctures could be carried out through the anterior fontanelle. Now we'll move on to the next view, which is the norma occipitalis. When the skull is studied from the posterior aspect, it is known as the norma occipitalis. The shape of this view is convex upwards and flat below. The bones forming are the parietal bones, which are paired, the squamous part of the occipital bone, the mastoid part of the temporal bone. The various sutures include the posterior part of the sagittal suture, the lambdoid suture, and between the two parietal bones and the occipital bone is the sagittal suture, and the lower end of the lambdoid suture meets with the mastoid portion of the temporal bone at a point which forms the junction of the occipitomastoid and the parietomastoid sutures. Now coming to the notable features of this view, that is the fronto-occipitalis. The first one is the external occipital protuberance. It is a midline protuberance on the lower part of the norma occipitalis. It marks a junction of the head and the neck posteriorly, and the term inion is the most prominent part of the external occipital protuberance. The next is the superior nuchal line. These are curved ridges passing laterally from the external occipital protuberance, and a very important notable attachments to this line is trapezius originates from this medial 1/3 of the superior nuchal line, and the sternomastoid is inserted to the lateral part of the superior nuchal line. The next important nuchal line is the highest nuchal line, which is situated about a centimeter from the superior nuchal line. An epicranial aponeurosis is attached to the medial parts. The notable foramen in this view is the mastoid foramen, which is located near the occipital mastoid suture, and the following structures passes through this foramen: the meningeal branch of the occipital artery, the emissary vein. Coming to some important applied aspects of norma occipitalis. This is the craniostenosis. What is craniostenosis? Is a condition in which there is premature closure of the cranial suture. When lambdoid and coronal sutures are involved, the skulls grow vertically, leading to tower skull. And fractures of the occipital bone can be both in the form of fissured and depressed type of fractures. The next view that we'll be seeing is the norma frontalis. When the skull is observed from the anterior aspect, it is called as norma frontalis. It is oval in shape, wider above than below. What are the bones forming in the norma frontalis? The frontal bone, the maxilla, the nasal bone, the zygomatic bones, and the mandible. The notable sutures of norma frontalis include the frontozygomatic suture, which is the suture or the junction between the zygomatic process of frontal bone and the frontal process of the zygomatic bone. Then the junction between the nasal part of the frontal bone and the frontal process of maxilla. Then the junction between the nasal part of the frontal bone and the nasal bones, which is called as the frontonasal suture. Then between the two nasal bones, there is a suture known as the internasal suture. The junction between the maxilla and the zygomatic bone forms the zygomatico-maxillary suture. And between the two maxilla, it is called as the intermaxillary suture. Now, the notable features of norma frontalis include, there are three main apertures, that is the anterior nasal aperture, and that is one anterior nasal aperture and the two orbital openings. The anterior nasal aperture is present in the midline. It is a pyriform shape and wider below than above. The orbital opening consists of the following important features, that is the supraorbital margin, which is formed in the frontal bone. It consists of a supraorbital notch and supraorbital foramen. The infraorbital margin, it is formed in the maxilla medially and zygomatic bone laterally, and the lateral orbital margin and the medial orbital margin. The other important features of norma frontalis in the frontal region include the superciliary arch. It is a curved elevation above the medial part of the orbit. Glabella. It is a median elevation between the two superciliary arch. Nasion. It is a junction of the internasal and the frontonasal suture. The frontal eminence is the rounded elevation just above the superciliary arch. Coming to the maxilla, the important foramen in this bone include the infraorbital foramen, which is about 1 centimeter below the infraorbital margin, and it transmits the infraorbital nerves and vessels. Then the incisive fossa, which is situated above the incisor teeth. The canine eminence, it is produced by the root of the canine tooth. The canine fossa, it is situated just lateral to the canine eminence. Now, the most important applied aspects of norma frontalis include traumatic alteration in the shape of nose because of fractures of nasal bones is of great clinical importance due to cosmetic reason, and the nasal bridge may be involved in the frontal process of maxilla. Next, we will move on to the norma lateralis, which is nothing but the observation of the skull from the lateral aspect or side. Now, the various bones forming the norma lateralis include the frontal bone, the parietal, the occipital, the nasal, the zygomatic, the temporal, sphenoid, and the maxilla. The various features of this view include the temporal lines, which is the superior and the inferior temporal lines. The superior temporal line includes, it starts from the frontal process of the zygomatic bone and arches upwards and backwards, and temporal fascia is attached to it. The inferior temporal line also commences at the same point. It runs inferior and parallel to the superior temporal line, and posteriorly it curves downwards and forwards to continue with the supramastoid crest. It gives attachment to the temporalis muscle. The important fossa of the norma lateralis include the temporal fossa. The boundaries of this fossa are anteriorly it is bounded by the zygomatic bone, superiorly by the superior temporal line, posteriorly by the superior temporal line and the supramastoid crest, and inferiorly by the zygomatic arch. The content of this fossa include the middle temporal artery, the deep temporal branches of maxillary artery, the zygomatico-temporal nerve, deep temporal nerves arising from mandibular nerve. So these are the important contents of temporal fossa. The next feature of this norma lateralis is the pterion. It is a circular area in the anterior part of the temporal fossa which encloses 4 bones: frontal, parietal, sphenoid, and temporal. These 4 bones form an H-shaped suture. It is located 4 centimeters above the zygomatic arch and 3.5 centimeters behind the frontozygomatic suture. The roots of the zygomatic arch diverge from this tubercle. Anterior root is the articular tubercle, passes medially in front of the mandibular fossa. The posterior root continues with the supramastoid crest. The next feature is the external acoustic meatus. It is located behind the mandibular fossa below the posterior root of the zygoma. Next is the McEwen's triangle or the suprameatal triangle. It is situated postero-superior to the external acoustic meatus. Next is the spine of Henle or the suprameatal spine. It may be present antero-inferior part of the triangle, and the mastoid antrum is situated about 12.5 cm deep to the suprameatal triangle. So approach to the mastoid antrum is through this triangle. The important process that is present in norma lateralis includes the mastoid process, which is a downward projection from the mastoid part of the temporal bone. It is present below and behind the external acoustic meatus. 3 notable muscles that you have to remember that can attach to the mastoid process include the sternocleidomastoid, the splenius capitis, and posterior belly of digastric. The next important process is the styloid process. It is a slender, elongated projection below the external acoustic meatus. It provides attachment to these 5 structures: anteriorly the styloglossus, posteriorly the stylohyoid, medially the stylopharyngeus muscle, laterally the stylomandibular ligament, and to the tip stylohyoid ligament. The next important fossa which is present in the norma lateralis is the infratemporal fossa. The boundaries of this fossa include anteriorly it is bounded by the body of the maxilla, medial is the lateral pterygoid plate, laterally by the ramus of the mandible, and the roof is formed by the infratemporal surface of the greater wing of sphenoid. The contents include the medial and the lateral pterygoid, the temporalis muscle. Arteries are maxillary artery and the posterior superior alveolar branch of third part of maxillary artery. The veins are maxillary vein, pterygoid plexus of venous plexus, the posterior superior alveolar vein. The nerves include the mandibular nerve, the chorda tympani nerve and the maxillary nerve. The other important features of this are foramen ovale and foramen spinosum, which are present on the roof of this fossa. The lateral part of the fossa communicates with the temporal fossa through a gap between the zygomatic arch and side of the skull, and this is called as the pterygomaxillary fissure. It is a gap which leads into the pterygopalatine fossa, and maxillary nerve courses forwards through it from the pterygopalatine fossa to enter the orbit through the infraorbital fissure. Coming to the applied aspect of norma lateralis, the spine of Henle is important surgically landmark for surgery, especially whilst operating on the mastoid antrum. The pterion is very important clinically because the anterior branch of middle meningeal artery and accompanying vein lie on its internal aspect and is vulnerable for tearing if there are fractures of the bone forming this region. Decompression of the brain in case of extradural hematoma in the region of pterion can be done by method of burr hole at this site. Next view is the norma basalis, which is the study of the cranium from the inferior aspect. The boundaries of this view include anteriorly it is bounded by the incisor teeth and posteriorly by the superior nuchal line. Laterally the rest of the teeth, the zygomatic arch, the posterior root of zygoma and the mastoid process. Now the anterior part of the norma basalis include the posterior border of the hard palate. It is formed by the junction of the anterior and the middle part of the norma basalis. The posterior nasal spine is a spinous projection from its middle in the median plane. The musculus uvulae, the muscle attachment, is attached to the posterior nasal spine. The alveolar arch possesses sockets for the roots of the upper teeth. The number of sockets depends upon the number of roots. There is a single socket for each of the incisor, canines and the premolars. There are 3 sockets for each of the upper molars. Bones contributing or forming the hard palate include the palatine process of the 2 maxilla contribute to the anterior 2/3 of the hard palate and the posterior 1/3 of the hard palate. And the posterior 1/3 of the hard palate is formed by the horizontal plates of palatine bone. The bony palate is marked by several depressions produced by the palatine glands. It forms a cruciform suture. It is formed by 3 sutures: intermaxillary suture, interpalatine suture and the palatomaxillary suture. Incisive fossa, it is present anteriorly in the median plane of the hard palate. The incisive foramen pierces it and each incisive foramen is traversed by nasopalatine nerve and greater palatine vessels. The next important foramens include the greater palatine foramen. The greater palatine nerves and vessels pass through it. Next is the lesser palatine foramen. The lesser palatine nerves and vessels pass through this foramen. The premaxillar area, it is a triangular piece of maxilla holding 4 incisor teeth. It is a separate bone in most of the vertebrates. The median area is the posterior nasal aperture. These are also known as the choana. The posterior border of the vomer, it separates the 2 choana. The ala of the vomer, these are 2 bony plates formed by the splitting of the vomer superiorly. It articulates with the rostrum of the sphenoid. The vomerovaginal canal, it transmits the pharyngeal nerve and the vessels. The next important canal is the palatovaginal canal. It transmits the branches of pterygopalatine ganglion and third part of maxillary artery. Coming to the process, the important process that is noted here is the pterygoid process, which is located just behind the posterior ends of the alveolar arch. The pterygoid process consists of a lateral and a medial part. The pterygoid plates unite anteriorly in the upper part to enclose a fossa called as the pterygoid fossa. The anterior surface of the pterygoid process forms the posterior boundary of the pterygopalatine fossa. There are 2 plates, the lateral surface of the lateral pterygoid plate, which forms the medial wall of the infratemporal fossa and gives origin to the lower head of lateral pterygoid muscle. The medial surface of the lateral pterygoid plate forms the lateral wall of the pterygoid fossa and gives origin to the deep head of medial pterygoid plate. Next is the scaphoid fossa. to the spine of the sphenoid, 4 foramen can be noticed here. That is the foramen versalis, foramen ovale, and canalicus innominatus and foramen spinosum. What is this foramen ovale? It is an oval foramen which transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. The foramen spinosum transmits the middle meningeal artery and the nervus spinosus. The foramen versalis transmits the emissary vein connecting the cavernous sinus with pterygoid venous plexus. Canalicus innominatus, this is also an infrequent foramen which is between the foramen ovale and foramen spinosum. It transmits the lesser petrosal nerve. The spine of the sphenoid, it is related laterally to the auriculotemporal nerve and medially to the chorda tympani and the eustachian tube. The sphenomandibular ligament is attached to its tip. Next is the foramen lacerum. It is located between the sphenoid and the apex of the petrous part of temporal bone, and it transmits the internal carotid artery, traverses its upper part with sympathetic and venous plexus. Coming to the squamo-tympanic fissure, it marks the junction of the squamous and the tympanic parts of the temporal bone, and the posterior part of the norma basalis consists of the most important foramen, that is the foramen magnum. It is the largest foramen in the skull. It is a single foramen located in the lowest part of the posterior cranial fossa. It is oval in shape and communicates the cranial cavity with the vertebral canal. Now, following structures pass through the anterior part, that is the apical ligament of dens, the membrana tectoria, and the posterior part includes the medulla oblongata along with the meninges. So, with this we have completed the various views of the skull, that includes the norma verticalis, the norma frontalis, the norma occipitalis, norma lateralis and the norma basalis. That brings me to the end of today's session. I will meet you with an interesting session soon.